Hello, everyone. Welcome to the April 2021 edition of Green Infrastructure, Climate, and Cities. My name is Franco Montalto, and I'm a professor at Drexel College of Engineering and one of the co-investigators of the Consortium of Climate Risks in the Urban Northeast, CC-RUN, which is a NOAA-funded team of researchers looking at the impacts of climate change on the urban Northeast. We're pleased to promote this event as the fourth CC-RUN seminar to be held during Drexel's Climate Year, a period during which we here at Drexel are celebrating, supporting, cataloging, and moving on climate. This evening, we continue our focus on climate and environmental justice. Oops, let me advance my slide. Okay, for those of you who are joining us for the first time, CC-RUN began hosting this series back in 2014. All of our previous seminars are archived on the ccrun.org website. Please feel free to watch any of them. You can go to the website and download whichever one you want, or actually watch it through a YouTube channel. As you know from registering for this event, we offer continuing education credits. During the seminar, please use the Q&A box to submit questions. You can upvote questions and raise your hand to ask a question orally. The chat should only be reserved for technical questions regarding the mechanics of the seminar series. A small act of respect and honor, we've come to use this slide in all of our seminars to remind the viewers that we're having these important discussions on the historical land of the Lenape peoples. And the Lenape peoples are now spread out, dispersed throughout the US and Canada, but we hope through the discussions that we have here that we're learning to better care for our small corner of the world in the spirit of the way the Lenape did before us, and hope that we can devise new strategies for equitably remedying the wrongs of the past. Before we get started today, we have two quick announcements. Over the next few weeks, we will be issuing a call for nominations. You can self-nominate or you can nominate someone else to participate in a series of working groups that are developing a climate resilience research agenda for the Philadelphia region. And you can see here the names of the four working groups, one focusing on the climate hazards, another one focusing on background health and environmental vulnerability, a third focusing on transformation, and the fourth talking about adaptation of the built environment. So we look for an email from us. If you've registered for one of these events, you will get an email with the nomination form, and these groups will be meeting over the summer and will be developing a research agenda that will be presented publicly in the fall. So we're very excited about this, and we invite you to participate in whatever way you can. The second announcement is I'd like to make a plug for a self-paced online course focusing on the impact of climate change on urban health. This is not just available to Drexel students, it's available to anyone. It's equivalent to about 4 hours of classroom instruction, and it'll be taught by Dr. Ione Avila Palencia. And the link, which is provided below, maybe we can put that in the chat for those of you who are interested in registering. Click on that link and you can register for this summer course taught between June 21st and June 28th. So finally, tonight we'll be returning to the topic of environmental justice with three speakers who will share examples of climate justice projects, including the ongoing Sea Heat Project, a collaborative study of heat exposure in Chelsea and East Boston, Massachusetts. So the three speakers will speak one after the other, and we'll have questions at the end. The first speaker will be Madeleine Scammell, who's an associate professor of environmental health at Boston University in the School of Public Health, and she's also a resident of Chelsea, Massachusetts. She studies exposure to heat, metals, pesticides among workers in various places, including Central America, and leads the Mesoamerican nephropathy occupational study. Sorry if I said that wrong. Our second speaker is Roseann Bongiovanni, who's the executive director of GreenRoots, a Chelsea-based environmental justice organization, and collaborator on the Sea Heat Project. So Ms. Bongiovanni has her master's in public health from Boston University. And then our third speaker is Patricia Fabian, who's associate professor also at Boston University Environmental Health Department. And her research spans the fields of environmental health and engineering, respiratory infectious disease transmission, system sciences, and geographical information systems, with a focus on asthma, indoor air, housing, and other aspects of the built environment. So we're really excited for the presentation tonight, and we hope you'll participate in the discussion afterwards. So with that, I guess I will stop sharing and hand the, stop share. Whoops.
Thank you, Franco.
Yeah, were my slides not sharing? I'm just seeing.
I could see them.
They were shared, yep.
Okay, sorry about that. I just got a strange message saying that I wasn't sharing. But anyway, thanks. I'll hand it over to Madeleine.
Thank you. And now I will turn the question to you. Can you see my slides?
Yes, we can. Yes.
Oh, thank you. That's great. Wow. Well, thank you all. What a great group. I mean, I wish I could multitask as much as sometimes is expected, but if I could chat with everybody and talk at the same time, I would, because there are a lot of you out there I'd love to chat with, but we'll save that for the end. And I want to thank CC Run for inviting us. And we're going to tag team a little bit. And I think, well, we're going to see how this goes. Roseann is having some technical difficulties, so I might have to hold her hand through some of these slides. But we're going to talk about our relationship. So you're going to see it in action, doing environmental justice research and action, and the partnership that we've developed over time. And it's sort of like culminated in our work with Patricia, and she's going to talk about the latest of our collaborations. But I'm going to give you a little context first to start off. In Massachusetts, where we are, suffice it to say that the patterns we see across the globe of injustices by race, ethnicity, and income in terms of environmental hazards, they persist here in Massachusetts even. And this report by Faber and Krieg, published first in 2001, pretty much says it all in the title: Unequal Exposure to Ecological Hazards, Environmental Injustices in Massachusetts, finding that hazardous sites and facilities are disproportionately located in working class towns and communities of color. And Chelsea is, in this report, identified the city of Chelsea as one of the top 3 most intensively and extensively overburdened communities in the Commonwealth. But this report contributed to the first environmental justice policy in the state in 2002, limited to the Executive Office of Environmental Affairs. But in that policy, it's really procedural justice, targeting communities at high risk of being unaware or unable to participate in environmental decision-making. And they defined environmental justice populations by characteristics including income, race, country of origin of the residents, and English language proficiency. So in Massachusetts, we have something called the EJ Viewer, where you can look at the demographics and how they relate to the EJ criteria for every census tract in the state. And to orient you, this brown blob here is mostly Logan Airport in East Boston. This is all of Boston here. And this little area here is the city of Chelsea, and these colors represent different variations of meeting one or more criteria. You can see red is all of the criteria are met in those census tracts. And at the time, Chelsea had the distinction of being the only city in the state where every single census tract met at least one, and a fair number met all of the EJ criteria. One reason for this people have considered is the historic disinvestment in our city. And this is a map from 1938, obviously not the original, but showing areas deemed as hazardous, redlined, and definitely declining. And I just also want to point out that this area here, not rated at all, was at the time a naval hospital. And if we look at the demographics of the city of Chelsea today, compared with the state of Massachusetts, we'll see a largely Hispanic or Latino population, very low median household income with a high percentage of people living below the poverty level and high percentage of tenant occupied units. But there is still variation by census tract, and just pointing to the variation here, I show you an area that on the prior map was redline deemed hazardous, and this was a former naval hospital, which is one of the largest green spaces, the largest green space in the city, and you can see the density and the demographics of those residents is very different, even within a small city of 1.8 square miles. So I'm gonna pass it off to Roseann Bongiovanni, Executive Director of GreenRoots, the grassroots environmental justice organization in the city, to walk us through some of the environmental hazards experienced by residents.
Excellent. Thank you so much, Madeleine. And thank you for everybody for being here in this opportunity. As Madeleine said, you can see from this aerial photo of Chelsea that we're a very densely populated community, and one that looks very gray, at least aerially. As Madeleine said, Chelsea is 1.8 square miles, so the smallest city in the entire state of Massachusetts, and the second most densely populated. And when you take a look at all of the zoning over the entire city, and break it apart by the different zoning regulations and codes, Chelsea residents actually live within 40% of 1.8 square miles. So you'll see here on this aerial photo that our community is just extremely densely populated in tight neighborhoods. Thank you, Madeleine, for pointing those out. And along our waterfront, or along the banks of the city of Chelsea, we're surrounded by water on three sides, by the Chelsea Creek, the Island End River, the Mystic River, and the Mill Creek. And again, you can see that there is very limited open space and quite a lot of impervious surfacing. So what you'll actually see when you're in the neighborhoods are these tanks along the water's edge, all along the banks of the Chelsea Creek. So the majority of the waterfront is what we call industrial zoning, or water dependent industrial activity. So you'll see 70 to 80% of the region's heating fuel stored in tanks like this, 100% of the jet fuel used at Logan International Airport stored again in tanks like this, blocking residents' views from the waterfront. This is a view of Global Oil. Global is just one of 7 oil terminals that line the entire Chelsea Creek waterfront, and Chelsea is shared by Chelsea, East Boston, and Revere. And GreenRoots, as Madeleine said, is a resident-led organization working to achieve environmental justice and improve public health and quality of life in the entire community of Chelsea and in East Boston, particularly along the neighborhoods that line the Chelsea Creek in East Boston. This is a view of the Eastern Mineral Salt Pile. And so just some fun facts. I'm sort of skipping ahead a little bit, but as I said, Chelsea is the smallest community, one of the most densely populated, but one that is shouldering the burden. Chelsea and East Boston are shouldering the burden for so much of the region's benefits for all of New England. So along the banks of the Chelsea Creek, you'll see 100% of the jet fuel used at Logan International Airport, 70 to 80% of the region's heating fuel, road salt in these massive mountains that you see here in this photo that are used to de-ice roadways in the wintertime for more than 350 communities in the New England area. Around the rest of the waterfront, you'll see airport-related parking lots. And these parking lots have replaced what used to be even heavier industrial activity. So when oil terminals left the Chelsea Creek, maybe they sold their business or they moved elsewhere, what they left behind were contaminated pieces of land, significantly contaminated, requiring millions and millions of dollars of remediation. And so one of the ways to remediate the land underground and to create some tax revenue in the community is to cap the site, do the underground remediation, and use the surface for parking. And because we're so close to Logan International Airport, you'll see many airport-related parking lots along the banks of the waterfront. You'll also see oil. We've noted from the history of organizing in Chelsea and East Boston. We've been in existence as an independent organization for 5 years, but we've been organizing in Chelsea and East Boston first as a grassroots committee and a program of another nonprofit, and now as an independent organization for over 25 years. And in our experience over 25 plus years, we've seen over 100,000 gallons of oil be dumped or essentially be dumped or released into the banks of the Chelsea Creek. In June of 2000, sorry, can we just go back one quick slide? Thanks. In June of 2000, there was a massive spill in the Chelsea Creek. It was 50,000 gallons of oil spilled into the Chelsea Creek. And we got about 5 seconds on the news coverage, and there was a cleanup effort that resulted in a $37,000 penalty by the Posavina company that was found for essentially being liable for that oil spill. Yet at the same time, maybe a week later, 10,000 gallons of oil spilled into Buzzards Bay in Cape Cod, a more pristine natural environment. And there was a massive cleanup effort that covered the media for 2 full weeks. Hours of coverage and concern, and hundreds of thousands of dollars went back into that area to restore that pristine environment. And so when there's an oil spill or a release in the Chelsea Creek, the companies need to simply clean their oil and leave it at the same level it was beforehand. So if the water was contaminated beforehand, after having spilled oil in it, you clean up that oil and you can still leave the area relatively harmed and not in good shape. And you'll see that there are oil slicks on our streets and lots of runoff and pollution that goes into the Chelsea Creek and makes the water quality just simply not swimmable, not fishable, and on some days not even boatable. You know, we always say these fun facts. I said some of them, but Chelsea Creek was also the home of the first Revolutionary War battle. It was a victory for the colonists. The Diana sunk in the Chelsea Creek, and rather than get a day off or have a celebration, we have all of the oil industry and the salt industry and so much of the region's industrial burden in Chelsea and East Boston. And yet the Bunker Hill, the Battle of the Bunker Hill, which is just one community over, was a defeat for the colonists, and they have bridges and monuments named after them and a day off in Boston celebrating the Battle of Bunker Hill. And yet Chelsea and East Boston sort of are the the ugly river just a little bit north of the city. But we are a very important waterfront that is connecting so much of the larger economic activity in New England, and residents living right in the shadow of this. So there are so many challenges for this work, but how do we move forward? There are a number of different ways that we as community organizers feel empowered to take action. And one of those ways is through partnership. So we partner often with pro bono lawyers to help complement our organizing, so that we have legal strategies that help support our organizing. But at the same time, we're also partnering with academic stakeholders and researchers to make sure that the research that they're interested in taking on is something that actually benefits the community, but is also answering a lot of the questions that we have. And so we have some real life examples here that we'll share with you today. We're studying air quality and reducing air pollution. We started this work over a decade ago, and it really started with this right here. This is an expanded environmental notification form, and it was for a project that was being proposed on the banks of the Chelsea Creek, right across from Chelsea's only elementary school. So you see in that green area there, it says the Burke Elementary School Complex. That's 4 schools within one large building. So every child in Chelsea that is going to public school in grades 1 through 4 is in that building. And yet right across the way, there was a proposal to site a dirty diesel power plant. A company that was proposing clean renewable energy for Cape Cod was proposing a dirty diesel power plant for the environmental justice communities of Chelsea. We found out about this project and we started to organize, but then we also turned to our partners in academia, our partners in law, and said, how can you help us to fight this project? And so this is a key example of how community members partner with researchers and academic partners, where this expanded environmental notification form was probably this thick with very technical information and really complicated for lay folks to understand, especially, even, folks whose first language might not be English, but even for myself, my first language is English, really complicated to read through this extensive study. And so we turned to our academic partners like Madeleine and the BU School of Public Health and said, help us to understand this data. And through that, we were able to determine that the air pollution numbers that they were showing in this report were only capturing 1/3 of a total day. And so essentially they were just showing a small encapsulation of what could be rather than what really would be. What would happen over the course of 24 hours? What kind of air pollutants would be emitted through the stacks of this power plant? And with that information, we were able to stop the proposal sort of in its tracks and say, hold up, this is not accurate information. You're not showing us the full story. Tell us the full story. And that helped to build up our leverage and support to say, this company isn't altruistic. They're not being truthful. They're not being honest. They're coming into this community and they're just trying to shoulder us with more burdens. We go to the next slide. This data here helped us to say, does Chelsea really need any more burdens? So when you're thinking about air pollution and putting pollution on a community that's already disproportionately impacted, what does that do to our public health? And so we analyzed our public health data, again, with partners, and saw that Chelsea's asthma hospitalization rates are some of the highest in the state. And you'll see in neighboring East Boston, their rates are even higher than Chelsea's rates at the time. And so we, used that information and said back to state partners, you cannot let this proposal go through. It will just exacerbate our already compromised public health here in Chelsea. And then looking at some diesel concentration numbers, we were able to see that according to EPA sources, that Chelsea's diesel concentrations exceeded the threshold level by 20%, and all of Chelsea had elevated levels of outdoor diesel pollution. And so that was really concerning, right? You can see these elevated levels, particularly in the neighborhood where they were proposing this dirty diesel power plant. So we equipped all of this information with our organizing tactics. We created flyers that look like this. So that's a playground that actually exists at the elementary school. We superimposed stacks from a power plant that's in neighboring Everett and said, this is what our children will be looking at when they're playing on that playground. This is not only what they'll be looking at, that's what they'll be breathing in. And so we use that information and those graphics to show folks exactly what would happen if this was allowed in Chelsea. So we took these flyers and sent them, far and wide in the community and to stakeholders as well. And then we continue to protest some of what we love to do best. We went down to the headquarters of the company that was proposing this, and we marched outside of their facility in downtown Boston and called a lot of negative attention to the company. As I said, this is one of the companies that was proposing, or this is the company that was proposing good, clean, renewable energy for Cape Cod, an affluent area. They were proposing a wind turbine farm off of Nantucket, which was controversial for not my backyard, NIMBY reasons. But they were proposing renewable, clean energy for the Cape and yet a dirty diesel power plant for Chelsea. And so we called on the company and said, this is environmental racism and environmental hypocrisy. And so as the president of the company was making a presentation at Boston University, talking about how the world really needed to wean itself off of peak oil, we got into the facility as sort of BU alum, the back ways in up through the balconies. And We distributed flyers to everybody in that ballroom, and then draped this banner over the ballroom sort of porch, or balcony, if you will, and it said, "This is environmental hypocrisy. Talk about the peak power plant using diesel fuel in Chelsea that you're proposing in a dirty diesel power. I'm sorry, you're proposing this dirty diesel power plant in an environmental justice community that already has some of the most compromised public health in the entire state." And so we were able to win that battle, and it was a huge victory, but that helped to launch us into this lifelong sort of quest for improving air quality. After having won this campaign, we couldn't say, "This is great, we're going to rest back on our laurels." We then found out just how compromised Chelsea's public health was, and how bad our air quality already was without this power plant. And we said, we need to do more. We need to proactively take on more work to clean Chelsea's air. So I'm going to pass the baton back to Madeleine.
Thanks, Roseann. Yeah, we engaged those same youth. You saw protesting in creating this map. We did not use GIS, as you can tell, to draw the areas that we thought were likely to have low, medium, and high particulate matter concentrations. And then we went out and we monitored particulate matter using side packs and working with the youth to see what does the air quality look like in the city at various locations, where they also took photographs and moshed them up with Google Maps, particulate matter at different concentrations in different places. So this was a small project, and it was pretty fun and informative, and the youth became very good at speaking about air quality in the city with data. But we also started talking in the community meetings about this area on the map, which was the New England, it still is the New England Produce Center. And there's a close-up, and I'm going to pass it off to Rosie to talk about the Produce Center and what we did there.
Awesome. Thanks, Madeleine. So yes, as we were examining just how bad Chelsea's air was, we saw this as a significant area of diesel pollution and a significant hotspot. And so one of our members said, "I'm going to get into the Produce Center. I'm going to talk to the guys at the Produce Center and see if they'll be willing to partner with us." And if you know anything about the Produce Center, you know that it's sort of a restricted area with a fence, really hard to get into. And unless you're in this industry, it's not a very welcoming space. And I said, "There's no way you're going to get in there, Kate. There's no way you're going to be able to foster these relationships." And she not only got in, she fostered lifelong relationships with these folks. In fact, I spoke with the president of the Produce Center earlier today. But what we were able to do was sort of similar to where we are in today's day and age. There was the ARA funding, American Recovery and Reinvestment Act funding, that was looking for shovel-ready projects. And so we went into the Produce Center and learned from them that they had over 32 individual businesses operating within this fenced-in area. They had about 37,000 reefers, which are these refrigerated trucks that are coming from across the country on an annual basis. It's the second largest produce center in the country, the single largest privately owned produce distribution center. And they had thousands and thousands of smaller trucks coming in and out to transport this produce. So essentially the produce is coming across the country, temporarily stored in buildings and docks at the New England Produce Center, and then transported out to all of the mid-Atlantic states and some southern Canadian provinces. And so as the Produce Center has aged and grown over time, they've lost the ability to have more space within their docks. And so they're using these cold storage reefers. So imagine an 18-wheeler truck without the front, cab part. That back part is essentially a refrigerated box. So they put a dirty diesel unit on the end and cool or heat the unit depending on the season. And they're running 24 hours a day, 365 days a year on some of the worst diesel pollution. So as it says here, red fuel, which has the highest sulfur content. So we went in with an opportunity to apply jointly for this ARA funding for Shovel Ready project. We were able to successfully get 2 of these grants over the course, 2 to 3 grants over the course of a few years. which translated into like $1.8 million in investments at the New England Produce Center and adjacent businesses outside of the Produce Center, including the salt pile and including some city vehicles. And through that work, we were able to retrofit or replace 132 dirty diesel engines and reduce annual air pollutants by 2,000 tons annually, and eliminated the use of 400,000 tons of dirty diesel fuel each year. And you'll see in this picture that those are some of the newer engines that we were able to replace. So that's the refrigerated unit up there on the left-hand side. That's the box trailer. And we took the old dirty diesel units that used to be attached there, destroyed them and replaced them with these electric units, which produce a lot less energy. They're much cleaner and they're a lot less noisy. They're much quieter and they have a longer sort of lifespan, if you will, and require much less maintenance. So it was a win-win both for the community in terms of air, but also for the produce center, which got a significant cost savings, and they were able to get this amazing grant, which was paid for 75% by ARA funding. They had to match 25%. And so these are some of our numbers. We like I said, we replaced these high sulfur diesel engines and some additional trucks that were owned by the city and by Eastern Rural Salt Dock.
Thanks, Rosie. Okay, so now I'm just going to talk about relationships for a moment, because in the time that Roseann and I have known each other in the city of Chelsea, I've been married and divorced, and I think a lot about relationships, and I would talk to my neighbors about, how do you do it? You've been in relationships for so long. This is like the light moment. And they said, oh, it's about intentionality. You should check out these sites. You say what you're looking for. Specifically, you talk about your identity. You talk about your background. And you talk about what you want out of a relationship. Is it a one-night stand? Is it a relationship you want to last several years or the rest of your life? Well, so it got me thinking about research relationships. And that when we think about doing work from the academic perspective with community groups, it's helpful to talk about what kind of relationship we're willing to engage in, what we're looking for on both sides. And in academia, this is just my word of caution. We use the word partner quite a bit, maybe sometimes casually, but in the dictionary, a partner really is someone who shares in the risks and profits of any endeavor, that are on the same side, really. And so I feel really great now about my partnership with GreenRoots, but it's definitely taken a long time. And so where have we been since then, that air quality victory? Well, we also did a large study with EPA funding, interviewing over 350 residents in the city, randomly selected in 5 census tracts. And you'll notice that this census tract here, where the majority of people live who do not have asthma, that's the census tract that I pointed out earlier. That was the former Naval Hospital with the green space. For the most part, asthma rates in the city are much higher than the state average. Hospitalization rates are approximately 40% higher than the average in the state. And this article by Patricia, Fabian, and others really helps to frame the movement of environmental justice from focused on ambient exposures primarily to also what are the structural influences on people's health that include where they live. And so working with Patricia and others at BU and Harvard Schools of Public Health, we have had for about 5 years the Center for Research on Environmental and Social Stressors in Housing across the life course. GreenRoots was a partner on that center. And we are really sadly at the end of our funding, but I just want to, before Patricia talks, I want to sing her praises for a moment because she teaches the GIS course at the School of Public Health. And at the height of the pandemic, COVID infection rates in the city of Chelsea were really increasing dramatically, and we could not understand why or where we were in the context of the rest of the cities and towns in Massachusetts. The chiefs of police of the 40 largest cities and towns in the state shared data amongst themselves, and we were able to get those data and examine COVID infection rates. This is early April through June, across cities and towns by demographic factors that would make them more vulnerable. And Patricia's students really pitched in on this, and it was a wonderful experience. And the Massachusetts Attorney General's office heavily referenced those data in this report, talking about the legacy of environmental injustice in the Commonwealth, the disproportionate burden of air pollution in these very same communities experiencing the increase in COVID infection over time, and the goal of building climate resilience. And I'm going to pass it on to Patricia now to talk about sea heat.
Thanks, Madeleine. So if you can go to the next slide. So as Madeleine said, amid the backdrop of COVID, with all the mandates for mask wearing and staying at home, we started thinking about heat. And this is a map of ambient temperatures across Boston, sort of in that northeast corner. That's where Chelsea, East Boston is. You can see where there's urban heat islands, so areas where the temperatures are hotter compared to rural areas or even other areas in the city. As you all probably know, heat is the leading weather-related killer in the United States, and most heat-related deaths are preventable. So heat exposure is associated with heat exhaustion and heat stroke. We all know that. It's also associated with things like heart attacks, strokes, and other forms of cardiovascular disease and many other different health outcomes. There's different groups that are vulnerable to heat, including older adults, diabetics, young infants. That's sort of the traditional kind of definition of who's vulnerable to heat. But people are also vulnerable in other ways, such as occupational. So for example, agricultural workers or construction workers, workers who might take public transportation to work, and that is the case for many essential workers. So this is the background for heat. It's a study of heat exposure and vulnerability in Chelsea and East Boston. It's a collaboration, so our partner is GreenRoots. So it's a GreenRoots Boston University project. And our goal is really to build capacity to respond to extreme heat events. And this is our website, sort of welcome you to kind of take a look at the resources that we've put together. So there's a lot of activities that we're doing as part of this. And what we're trying to do is do research that intersects the community needs and interests. If you can go to the next slide, Madeleine. Yeah, great, thanks. Community needs and interest, what the city is planning in terms of adaptation and mitigation plans around climate, and then how can we as researchers sort of build resources and inform a lot of what the community wants and needs, the city is planning, etc. So we have a pretty large advisory board, and these are some of the partners. So Mystic River Watershed Association, Neighborhood Development, Chelsea Housing Authority. Those are community organizations that are interested in heat resilience, thinking about the communities that they serve. City of Boston, City of Chelsea, that's kind of what are they thinking about in terms of what they're doing for their cities. And then obviously GreenRoots, which is we're partnering with. One of the first things we did was build a data dashboard of any public data that we could find that could relate to either heat. So there's things like land surface temperature and ambient temperature. And then thinking about how we could put together resources that somebody might need. So for example, one of the requests that came from a community, from our advisory board, from a community organization was, can you tell us where there's rubber roofs? Because we are thinking of doing either green roofs or white roofs as one of our summer intervention plans. And so we found some parcel data and put together, that's that map sort of on the left. showing where there are rubber roofs across the city. Obviously, green space is something that cities focus on a lot. So, putting together where there's green space at a small scale. So some of this could be about having a backyard where you can spend time outdoors. That's something that became more important with COVID, where people couldn't go to different places. Some of it is parks. Some of it is sort of non-traditional green spaces you might think of. So things like there might be a cemetery that has green space. So kind of characterizing that across the city. And that third example is, for example, where there's air conditioning. So this is a map of East Boston. Each little square is a parcel, so it's basically a building. And you can see that the pink is where there's no central air, and the blue is where there's central air. So you can see basically no central air. If anybody's lived in Boston, that's not surprising. Mostly the buildings are really old, but we have really old housing stock in general. So there's a lot of window units, but not so much central AC. We also built databases around populations. So where do older adults live? Where do younger kids live? Thinking about income, household income, again, housing age, and all of that lives on the website. And then we're now sort of creating more custom maps of layers to kind of help answer questions about, there's an urban heat island, maybe where are the bus stops, sort of doing these combinations. In response, right? So we sort of built what we thought could be important, but then sort of putting it together better now with feedback from community organizations. Second piece that we did is actually do some temperature monitoring. So this is a map of Chelsea, and all the yellow and red are where we put sensors. We installed them in trees, and luckily we were able to partner with City of Chelsea, and they helped us install everything, and then we would kind of go around and download data. At the time, City of Chelsea also got a municipal vulnerabilities planning grant that is focused on thinking about interventions to reduce heat exposure related to infrastructure. So things that they could do in public spaces, things like roofs, trees, white roofs, green roofs, etc. So part of this sampling is kind of informing where there might be more impact. And the next slide shows you the results of some of these sensors. So each of these boxes is a sensor. This is an example of a hot week, which was August 21st through the 28th. And you can see that there's a pretty big difference across the city. So same week, same days. And if you click on the next one, you can see that the reason why is because the sensors kind of here on the left of the graph were installed in areas that had a lot of green space. So this is one of the parks. And then the ones that are hotter, kind of on the right, that's an area, it's 3rd Street and Cherry, which as you can see is very developed, has a parking lot, lots of buildings, and very little green space. So that's sort of outdoor temperature sampling. And then indoors, we recruited 24 residents living in Chelsea and East Boston. And then what we wanted to find out was, what is their indoor environment like? So what's their temperature exposure indoors? What's their personal temperature exposure? And then what might be some health kind of indicators? So they wore Fitbits for 6 weeks. It was a pretty long time. They were really committed. They were amazing because they wore Fitbits for 6 weeks. They carried around these Hobo, which are temperature monitors, hung some others on their house. And then we were challenged because of COVID, right? We normally would be able to go and talk with people, go and collect data, explain what we're doing, be able to answer questions, make this part of sort of an education, get feedback from them, what works, what doesn't, be better able to listen to them. So we had to do everything remote. Really amazing team of research assistants and doc students who put together these protocols where we did everything via Bluetooth and via phone, via Zoom, did some training. And so this just kind of shows all the different sensors that we used to collect data, and then kind of all the programming that went behind it so that we could actually collect it remotely and store it. Most of these measurements were every 10 minutes. And this graph shows a picture of the same week, so that same hot week, but these are indoor temperatures and what the distributions are. So again, each box is one participant. And you can see that the temperature, mean temperature ranged from, I don't know, maybe 68 degrees to kind of closer to 80. The gray box is what ASHRAE considers to be a comfortable temperature range for the summer, which is 75 to 80.5 degrees. Not taking into account humidity, this is just temperature. So you can see that a lot of the measurements fell outside of that comfortable temperature range. The ones here on the lower end were people who had their air conditioning cranked pretty high, as you can see. And then maybe kind of moving to the right where there isn't as much air conditioning used. This is a comparison that we did looking at indoor mean temperature compared to outdoor mean temperature the same day. And what we found is that 87% of the time, mean indoor temperature was higher than outdoor temperature. And that the temperature difference between the nearest sensor of the ones that we hung to the participant's home to the indoors was around 7 degrees. So, you know, if outside it was 80 degrees, indoors it could be 87 was sort of the max, with a range of 3.5 to 9.7. So if it was hot outside, it was even hotter inside. What did we learn from the participants? Because this is all sort of measurements, right? We put a sensor in someone's home, and this is what we can say about the actual measurements that we took. But then we did a pretty extensive questionnaire. And again, you know, it was about an hour. Participants were really patient, you know, sort of answering all the questions that we had and sharing what their experience of heat was this last summer. So 100% of our participants had some form of AC. So either a window air conditioner, or central or freestanding air conditioner. But 50% of participants said that the conditions in their house last summer were hot, and 30% that it was warm. So we were asking this summer 2020, we were asking about summer 2019. And then on a typical summer day, sorry, if you can go back one more, that they used air conditioning about 8 hours during the day and 6 hours at night. And when we asked about financial health in terms of potentially ability to pay for air conditioning, 38% of them said they had choices about which bills to pay. So yeah, next slide. What they said about what they did about heat adaptations. So their most popular strategies that they reported were turning on the air conditioning, removing clothing, and opening windows. People spent around 75% of their time at home. This compared to the national average is usually around 69%. It's a COVID year. So, you know, we expected that number to be much higher. It's just different. It was a different year. Half the people don't leave their house for a cooler area. And then we did some location data analysis and found that when people weren't at home, they were either in transit, at retail establishments, or outside in green spaces. So everything that you would expect. 60% of them were aware when it was really high extreme heat or sort of heat warnings. They were aware that there were heat warning systems, mostly through television. 50% concerned that others would become ill. And about 33% identified that heat disrupted their sleep. A lot of them also reported that noise disrupted their sleep. I think more people reported noise compared to heat. We asked them about hydration, and about 40% of them reported not drinking enough water. So this is a picture of these new hydration stations that Chelsea just installed around the city. You can see this was the inauguration for one of them. Rosie's standing there. And the idea is that, first of all, there's more access to water, and then there's an opportunity for sort of education around drinking water. Although there's many reasons why people are reporting not drinking, including not liking the taste, not trusting the quality, but again, sort of opportunities for intervention around dehydration. This one is about transportation. So 80% of the people in our study reported that they use public transportation for getting to work and buying groceries. 60% of them changed their mode of transportation due to COVID and heat. And a lot of that change is either driving their own car or taking something like an Uber or a Lyft, so that they're in a vehicle instead of in a car, like an individual car, as opposed to public transportation or walking. So this was sort of, what I'm trying to say is, like, this is what the residents are saying in terms of what their experience of heat is and what matters to them and how it affects them. We also took a look at what are cities doing. And there's a bit of a mismatch in sort of well, what are cities thinking of doing? And then what are people experiencing and what might be able to help them deal with heat exposure? So some of the things that other cities are doing, and City of Chelsea and City of Boston are also considering some of these, are having cooling centers. So existing buildings, like here, the Chelsea Public Library, for example, making that into a place where people can go spend time and it's air conditioning, they can cool off. Doing something like green and white roofs being painting a roof, right, that reflects the heat instead of absorbing it. So it contributes to reducing urban heat islands. Green roofs, right, would be sort of planting. So there's a trade-off there in expenses and in cooling, or things like misting stations at parks where people can kind of go cool off. A misting station would be some kind of water installation with a fan. And so it's like physical cooling off. These are all great ideas. They, again, sort of mismatch a little bit with what's possible to do with residents. So this is what we're doing now, is kind of trying to bring together all the research that we're doing, all the information that we're collecting, figuring out how all our mapping activities can inform all the, where do you put a green roof or a white roof? Where might you need a hydration station? And then thinking about, well, can we think beyond sort of physical changes that you can make onto a city like green space and roofs, and think about, well, how can people pay for air conditioning, or is there a program for people to obtain air conditioning? Thinking about transportation alternatives, and it's an ongoing project. This is our second year. We're sort of planning for this next summer, and so more to come on sort of hopefully good outcomes to this project. And I think that's all we had. So happy to take questions or comments.
Thanks so much for those. Are this was exciting work just to see how much progress you've made. And I guess there's one of the questions, Roseann, you wanted to address. This question about how did you win, and I guess that's referring to the power company that was. So I don't know. You want to answer that question?
Yeah, sure. So we actually won on a state law called Chapter 91. It's the public trust doctrine, and it's basically what used to be publicly available tidelands, so waterfront areas that used to be open to the public. Now anything that is owned sort of privately, whatever is developed within that jurisdiction, that Chapter 91 jurisdiction, for every 1 foot of development, there needs to be 1 foot of open space, and you need to get a license, a Chapter 91 license, to build on that space. And the way the company had designed their proposal, they were designing it in such a way that they were within the Chapter 91 jurisdiction. And so the state essentially came back to them and said, we're not going to allow you to move forward as you've designed this proposal. And so they had a few different options. They could appeal the state's decision, they could redesign the proposal, or they could just accept the state's decision and move on. And because of the widespread opposition, they ultimately decided to accept the decision and move on. And so they never developed in Chelsea, although they weren't a great company. They ended up proposing their development in another environmental justice community. And that community was fighting as well. And ironically, the site has sat vacant for all of these years. This happened in 2006, 2007. And I met with the new owners of the site today, who are reaching out to us to ask us to help them design some really meaningful access points to the Chelsea Creek. And so it was really exciting. And they're going to be coming to a GreenRoots meeting in May to talk with the community about what would you like to see there and how would you access the waterfront. And so I think it's, a long time coming. Thanks for that. And I see a follow-up from Lisa Hastings, who asked that question, is working on air quality issues here in Philadelphia. This is above my understanding, but the question about whether the Chapter 91 provision was necessary for this. Maybe you can just tell us what that means and whether that. Yeah, so essentially all of these waterfront, this is a law that is in place in Massachusetts. I don't know that it's in place other places, but I imagine it's sort of similar. Again, what used to be public tidelands or public beach area or waterfront area that has become privately owned, there needs to be state permits granted when you're developing in these areas. And so a Chapter 91 license is necessary when you're developing within these public tideland areas. And so all along the Chelsea Creek, there is a line of delineation essentially along the zoning corridor, but then there's another line that somewhat follows where there's used to be publicly accessible tidelands that are no longer publicly accessible, where you're required to get this license, this Chapter 91 license. And we've used that tool pretty frequently to stop projects that aren't beneficial to the community. And this is a great example of where we've complemented community organizing with community lawyering. So we have the organizing tactics and the pro bono legal strategies to help us to sort of challenge permits and have a meaningful way for community members to participate in these state permitting processes.
Thanks, that's great. So David Rubin is asking, does the city of Chelsea expect to receive funds from the American Rescue Plan? And if so, is it allocating funds to environmental justice?
Great question. You should Google that. I'm sure you'll get a lot of good news coverage. Essentially, the city of Chelsea is getting ARPA funds or American Recovery Funds. However, the calculations that the federal government used are sort of archaic and didn't necessarily favor Chelsea and three other communities. So Chelsea was the hardest hit community in the state by COVID-19. We had the highest infection rates for months on end, and you'll still see that people are in blocks long lines for food pantries, and there's about, I think, $10 million outstanding in rental arrears. There's just so much economic and public health devastation that hit our community. And so we should have been one of the communities that got the most amount of ARPA funding. And because of this archaic calculation, we were only getting $4 million. While a community, say like Newton, which is much more affluent and had far lower levels of COVID infection, was getting something like $80 million. And so we had a community organizing strategy and campaign to try and get additional funds and resources. So now Chelsea will likely get an additional $30 million in federal dollars, plus some additional funding from the county distribution. So it will be closer to, I think, $40 million. But as I said to somebody earlier today, there's nothing in the city that you don't have to fight for. And so just like that, we had to fight for the ARPA funds that should have come more readily and more accessibly to Chelsea and communities like Chelsea.
Thank you. There's another question for you, but I'm wondering if I can sort of, before getting to that question, sort of talk a little bit more on the about the research sort of community collaboration piece of this. And if the three of you or your institutions had established any sort of principles for engagement, standards for, what was the role of students versus faculty versus community members in the research? I mean, you showed some pictures of community members collecting air quality data. How were those responsibilities parsed out, and was that formal, or did it just kind of emerge from your own personal relationships?
I guess I'll start responding to that first. I'd say it has been both formal and informal, and it emerged. So I'd say there have been many informal instances, like the collaboration around the power plant was really like just everybody pitching in with information and expertise, and Roseann making phone calls, asking people questions, and people reviewing documents and volunteering their time. Whereas with Creche, we had formal agreements, memorandum of understanding, but there are a lot of things that didn't get included in that, about publishing and data ownership and the role of students. And I feel like we didn't do some of those formalities because of my familiarity with the community, and if I could do it all again, I would have added a lot more of the more formal agreement language that community university partnerships have.
I mean, I could just add really briefly that I feel like all relationships are built on trust. And if there's no trust, the relationship doesn't work. Sort of as Madeleine said with the match.com hookup or meetup earlier in the presentation, if there isn't trust and honesty and an open communicative relationship, it doesn't work. And I think that is what is so important about our partnership with Boston University. I feel like if there is a project that I don't agree with, or a direction that we're going in that doesn't feel right, or the community feels excluded, or if there's any concern, I have no worry in bringing those issues or concerns up to the team at BU School of Public Health. That isn't necessarily the case with all other research partners. And so I feel like my advice always is build the relationship and build the trust and have that communication flowing both ways. Otherwise, the relationship will fail. There you go. That's my relationship advice for the night.
But I mean, in terms of sort of like data collection, to the extent that there was on the ground data collection, was that done through civic science, or did you have students from the university walking around in the communities, or was it some combination?
Go ahead, Madeleine, you could take that.
It's been a combination of, sometimes depending on the project, GreenRoots does all the recruitment and data collection. Sometimes it's a partnership with a student and a community member going door to door. And there have certainly been times where it's mostly students and BU people collecting data, like from the air monitors, the stationary monitors, for example. It depends on the capacity also, I would say, of the community partner, in this case, GreenRoots, because everything takes time and staff effort.
Just to build a little bit on that, I'd say also funding, right? So I think the way that community engaged research has happened has been in a positive direction, and that it can't be just volunteers, right, that kind of help shape the research agenda. It can't just be sort of a token amount of money to have someone come to meetings, but actually have meaningful funds where you can hire someone that can be on the community organization that can also meet the goals of the organization. That's not just there to meet the goals of the research. And I would say that's pretty critical way to think about it for anybody doing this type of work moving forward, is that it just works a lot better that way, right? Sort of aligning goals of the community organization and the research, right? And second, having funding behind it that really is sufficient to cover people's time and effort.
Yeah.
Can I just jump in sort of quickly? I see that Lisa has a sort of follow-up question that's related. I would say that one key thing that has really meant a lot is that Madeleine is a Chelsea resident. People know her from volunteering in the community. They know her as a member of GreenRoots. She was on the Board of Health for 10 years. So we didn't necessarily have to build trust with Madeleine. She already had trusted relationships in the community. And so that helped to open the door for other folks at BU. It helped to feel like there's, if we can trust Madeleine, then we can trust Madeleine's colleagues, and she's not gonna do wrong by the community. So she's gonna bring in good folks who will appreciate and uplift the lived experience of residents who are involved.
Great, thanks for that. Let's go back up to Miriam's comment. She's talking about the Suffolk Downs development and wondering, and I guess maybe you should mention what that is for those who don't know, but was this part of your effort?
Yes. So Suffolk Downs is a former horse racetrack. It's on the East Boston and Revere line. Most of it is in East Boston. It's a site not far from the Chelsea Creek that is expected to be impacted by climate change in the next few decades. And there is a massive development planned for Suffolk Downs that will be a 20-year project. If I'm not mistaken, it's 10,000 units of housing and several 100,000 square feet of commercial development. And the residents of East Boston were actively opposing it because it's a massive project, because it's going to further displace folks from East Boston. It's going to, skyrocket an already rising housing market, and it's not climate resilient. And so GreenRoots was one of the founding partners of what is called El Pueblo Coalition, which stands for something that I don't remember, but essentially it's a grassroots coalition of residents, mostly Latinx residents in East Boston, who are fighting against the Suffolk Downs development. My colleague John Walkie, who oversees all of our waterfront work in East Boston, is really active in Chelsea. He lives in East Boston. He and Noemi, our waterfront initiative organizer, who also lives in East Boston, we're organizing other residents to be involved in the process. There were dozens and dozens of meetings. Ultimately, part of our victory, I would say, is that we filed legal action against the city and against the state for holding meetings without interpretation and providing language access. So they essentially excluded a majority of the residents of East Boston from meaningfully participating in this process. And that changed the BPDA's public processes, if you will. So now they're interpreting all of their meetings in several different languages, not just into Spanish, and they have to do much more meaningful engagement in environmental justice communities like East Boston. Unfortunately, the development has made it through most of the public permitting processes. They don't have their final stamp of approval yet, and we're still sort of actively challenging that and additional sort of displacement work in East Boston. And we've been active in trying to get the city council to increase the level and percentage of affordability sort of throughout the city. And so we're working with a lot of partners on anti-displacement efforts in Chelsea and East Boston.
So this gets into the question posed by Anna Yee, which is that, so you are, this environmental set of environmental justice collaborations has sort of morphed into advancing other types of meaningful change. How about has the partnership gone beyond, these two institutions, the university and the grassroots organization, to include private sector folks in any way, or local government?
Yes, we're working in that direction. I just, sorry, I want to hold that question for a second to
Sure.
Also address the issue of environmental justice and other EJ issues and collaborations beyond Chelsea, because I started by mentioning the EJ policy in Massachusetts, and we've just had a major climate bill passed by the governor that will formally determine an environmental justice community in the state of Massachusetts. And I think in terms of EJ policies nationally, it's pretty progressive. And GreenRoots was one of the conveners of the Environmental Justice Roundtable that included a number of stakeholders that have been meeting over years to basically write versions of that legislation. So maybe we can come back to that, but I think, yes, businesses, as with the produce center, we've been talking to, certainly foundations and businesses and government agencies have been, especially in the last year, eager to help find solutions for many of the injustices that have become so apparent in the city. Yeah. Anyone else?
So there's a question from Andrew Taylor, who acknowledges that he's EPA 3, Region 3 program manager, about student participation and credit, involving sort of working with this kind of community-based work. Is it incorporated formally into credit given to students for research? Is there anything to encourage students going from semester to semester, continuing to do some follow through on the work, or, I guess just some more details on student participation would be helpful.
Sure. Patricia, you want to?
Sure. I mean, I can speak more to sea heat, not so much the past activities, but the way it's integrated is through things like research rotations or practicums. All School of Public Health is a graduate program, so it has master's and doctoral students. But we also have undergrads working on things through the Europe program, which is the undergrad research program. So it's not formally part of sort of credit bearing activities at school, but it certainly goes into other types of requirements like internships and practicums. And then I know for other types of Madeleine, like past activities, how that worked.
Yeah, I mean, I think our department has an NIHS 232 grant focused on environmental epidemiology in community settings. So we try to create opportunities for our doctoral students to think about their research from the perspective and questions among residents of communities who are on the front lines of environmental health hazards. And it's a lot messier. One of my doctoral students said when she interviewed, I don't want to do community-based work. It is so messy. I will never do it. And that was Judy O, who ended up doing her dissertation research in Chelsea, going door to door and learning Spanish. And she was pretty amazing. But yeah, it's not for everyone, but we really try to prepare students to do it and to do it well, if that's their inclination.
Sort of you used the word messy, and I know there's a discussion going on in the Drexel community about incentivizing community engaged research of this sort. And I'm wondering, so it sounds like for some of the students, the messiness was not a deterrent. They ultimately got involved. But for faculty, how broad has your collaboration been? I mean, how is it the two of you only, or has this work attracted, sort of participation from others? And I'm in particular curious about level, like folks who are pursuing tenure. Have they leveraged, doing this work to kind of advance their status in the tenure process? I'm just curious about that. It's just because speaking to the larger Drexel community, because I know that there's interest in thinking about incentives for doing community engaged work.
Well, I'm so happy you're asking this question. It's one of my favorites. We do not have a tenure program at the School of Public Health. It's like many schools of public health on medical campuses. We're pretty much all soft money. So it's really sink or swim. And but amongst ourselves and amongst other tenure track faculty, I'm always hearing, oh, I was advised not to do community engaged research until after I get tenure. And among doctoral students, I hear, I should not do community work until I get my doctorate because it's too political. People will think I'm biased or I'm not a real scientist. And it takes a lot of time. The priorities are not always aligned so evenly with what the student wants to study or what methods they want to learn with the questions and the real concerns on the ground. But I always say, I think we need to change the institutions who are rewarding this work and demonstrate, lead by example, that the science is very strong and meaningful contribution to the literature often that's generated in partnerships with people on the front lines and in academia. And the impact, if we're in the business of improving public health, we should really engage everyone in that process. I don't know if others want to chime in on that.
Patricia, do you want to say anything on that point?
I think if you want your research to matter, you have to engage somewhere, whether it's on communities or on policies so I think the message of not engaging, and I don't say it's messy, I think it's just about aligning, like figuring out smart ways to align interests, right? And if you can do that, then you should. So we don't have tenure at BU, so have not had to have that conversation with anybody. I would say, I don't know, do the research that you love, the productivity follows it. And if it's community engaged, then that's what it should be.
Yeah, no, I couldn't agree more. And as someone who's done a lot of community engaged work myself, I actually think that, the research questions are much harder if they're derived with community engagement, because you know, that it's not just the logical next step of the last paper you wrote. It's now got to go in a different direction, and it sort of challenges us as researchers to sort of stretch the you know, what we can do with our science to be the most impactful, I guess. So thanks for those responses. I did have a question, more of a specific question on the work you did with the Fitbits in people's houses, because we have actually a heat risk mitigation study going on in North Philadelphia, and this question came up, and there was some just some discussion about privacy. And I'm just curious, were those individuals who measured temperatures inside their houses, was that sort of anonymous? Did you know who they were and where they lived, or how was it more just sort of, you know, these are background people who live in the community and this is the experience and we don't really care exactly where you live?
No, we definitely cared where they lived. We were trying to, we actually were trying to get sort of diversity across types of housing, whether people lived in urban heat islands, so areas that were hotter. But it was a cohort. So we recruited them, consented them, we knew where they lived, you know, asked them questions about relevant to their heat exposure, right? In terms of what sociodemographics, for example. We didn't have cameras inside people's homes, so it wasn't that kind of a study, right? It was just a sensor, it was a temperature sensor. So I don't know, there wasn't really ever anything voiced in terms of concern from a privacy perspective.
Mm-hmm.
I think when we first were designing the study, I was a little concerned that folks might not want to be, you know, followed with like the GPS sort of the tracker thing, especially in a community that has a lot of undocumented immigrants. We wanted to be really sensitive about that. And so I think that the team did a really great job of checking with folks before, you know, it wasn't like, here it is, you're going to have this monitor. It was, you know, a real process of communication and asking folks if they felt comfortable with that.
So that's a good point. And also, so then the way we adjusted was adjust the algorithms to say, we will only sort of capture the amount of time that you spent at home. So we were not sort of following people and then saying, you were in this house and then you were in this house and then this is where you went. It really was, this is what we want to know, is how much time you spend at home versus in, say, maybe commercial establishments or parks. That's it. And we're not sort of looking or sort of reporting or anything else. And that definitely was something that, from the data perspective, you would have just collected the data and just characterized, right, people's paths, I guess, if you want to think about it. And then sort of listening to concerns, okay, well, we need to adjust this and did. So yeah, forget about that.
Great. Well, thank you so much. Don't seem to have any more questions. I'm looking at the chat as well. I don't seem to have any more questions. Do you? Go ahead.
Sorry. No, I just say, like Corin was saying about bringing in interdisciplinary researchers.
Oh, I see that in the chat now. Yep. Mm-hmm. Go ahead.
So I think the trick is to know what everybody's doing and maybe get their students engaged in things, right? So again, from the CHE perspective, I feel like it's been easy to reach out to the computer science group to talk about how we're going to make protocols, right? How to, the epi people who are doing heat work, and we've lent them our sensors, for example, because they're doing a pregnancy and heat exposure study. So I think it's maybe meeting people where their interests are. And I don't feel like we've had any issue kind of working with engineers and community scientists. Like, I don't know, Madeleine, you're laughing. Do you disagree?
I'm laughing because you are an engineer.
I am.
and that's often something that we joke about, that we're, you know, I'm a more traditional public health scientist. Patricia's trained as an engineer, and we have different skills that complement each other. And I think our field is pretty interdisciplinary, but social scientists, even then, I think we've developed some research relationships with sociologists, and I think there's a contribution to be made as well.
Absolutely. Okay. Thanks so much for sharing this experience, with us. We look forward to seeing more data as it comes through. Are there any kind of closing thoughts that any of you would like to share with the group about doing this kind of work, about collaborations between community organizations and universities?
I'll just share one thought. I think climate is a good unifier for interdisciplinary research, meeting communities where they are and community needs, and then thinking about funding. So I think framing a lot of what we do from a climate perspective is a really great way to kind of try to move all of this forward. So.
Yeah, I think that's been a point, as I mentioned in the intro. Drexel is this year's climate year at Drexel, and it has really been an opportunity for bringing together folks who have been working on little pieces of the climate challenge in their discipline, in their department, but bringing us together. And now we're trying to figure out how to sort of bring them together in service of community organization or community needs. And so that was sort of behind the questions of these like principles of engagement or sort of standards for accelerating this type of, which is so important.
I guess I would just thank you all for convening us and for your interest. And yeah, that I think in our field, we've studied a lot of problems and we're really good at documenting problems. And maybe we need to do better at solutions and finding them quickly. And so I'm hopeful that we can all together.
Absolutely. Well, with that, I will thank you, the three, unless Roseann, you wanted to say something, I'm sorry.
Nope, I don't. Thank you so much for, bringing us all together. It was really great.
Yeah, thanks so much. This was a really great session. And please join us again if you'd like next month. And you'll be on the mailing list now that you're speakers, so you'll find out about us.
Great. Awesome. Thank you so much.
Thank you.
Thanks, everybody.
Bye-bye.
Bye-bye.